Well, it's a 12-day lockdown, a total lockdown in Chennai and in parts of at least three adjoining districts of Chengalpattu, Kancheepuram and Thiruvallur. It's in a sense reverting back to lockdown 1.0. We are on the GST road, a normally busy road, but now it's completely deserted. This is the road that connects the Chennai airport and takes you into the city, but hardly any traffic. That's because there's no public transport, and even private vehicles have been completely prohibited this time. Officials have told citizens, residents to buy everything they require for the next 12 days over the last 5 days when it was announced. And in terms of shops, only shops selling groceries, fruits, vegetable, pharmacies, medical shops and labs would be allowed to remain open, and even these shops can remain open only till 2 o'clock in the afternoon. This is the Alandur metro station. The road is completely deserted. Chennai's positive cases inching towards 40,000, and it's a make or break moment for health authorities to make sure they implement this and ensure the chain is broken. And that's exactly why this kind of lockdown, and there'll be intense lockdowns on 2 Sundays in between. On those days, even the vegetable shops would remain shut, only milk shops would be open. All through these 12 days, the restaurants can only offer takeaways. There can be no dining. Prepaid auto rickshaws, taxis are allowed only to pick up and drop passengers at Chennai airport or in the railway stations. And of course, taxi services and private vehicles can be used in case of medical emergencies. And officials say they will implement this total lockdown very strictly. They've erected barricades all along to make sure people who travel unauthorizedly would be taken to task, will be booked, the vehicles seized. We are passing through 2 key landmarks: the Rippon building, the headquarters of the Chennai Corporation, the road that's connecting the Chennai Central Station. It's hard to believe this road is so free on a weekday like this. In fact, this road also connects the Tamil Nadu Secretariat, the Fort St. George on the other side, and a clear view of the Chennai Central Station, a huge landmark in Chennai. And on the other side is the Rajiv Gandhi Government Hospital, and adjoining that is the Madras Medical College Hospital. When you would say a new norm, as Chennai tries to break the chain so that the numbers could come down, as otherwise many are worried that this could actually rise exponentially and the situation could actually go out of hand. We are crossing 2 important landmarks on Anna Saleh. This is the famous Spencer Plaza, the famous complex, and on the other side you have the LIC building, once Chennai's tallest building, of course still a key landmark. That's the LIC building on the Anna Saleh, and again police tightening screening of all the commuters, in fact. So that's the LIC building, and again on the right side, if you see, all the shops remain completely shut. As I told you, except shops selling fruits, vegetables and groceries, all shops ought to remain shut. Restaurants cannot allow people to dine, no tea shops. So it's going to be, in a sense, much difficult, harder than lockdown 1.0, a new norm, as Chennai tries to break the chain by enforcing yet another lockdown for 12 days. In Chennai, with Suresh, Sam Daniel, for NDTV. The LIC building, what you see here.